You mentioned about the psycho-oncology support. In broad terms, we're talking there about attending to the emotional side of cancer, really the psychological and emotional aspects like worrying,
Yes.
depression,
Yes.
feeling that your body image has changed.
I think I felt lost at first, completely lost, because I didn't know, after so many months of feeling fine, mentally and physically, why I'd suddenly fallen apart. It took some time, I think, through the psycho-oncology service to realise why I felt that way. Which is getting used to the change in your body, anxiety about getting cancer back.
A lot of uncertainties there about
Yes.
what's going to happen in the future.
Yeah.
And all that medical treatment's generally focused on getting you well now. But people might feel still uncertain about the future.
Yeah, I felt very scared about the future. Very scared. I thought I was going to get cancer back.
Yeah.
I can remember fracturing my ankle actually and not going to the hospital because stupidly, even though I had breast cancer, I thought, well, what if it's bone cancer? So I went to work, this was a few months after, and hobbling around on a broken ankle, and they sent me to the hospital. And obviously it was just a broken ankle.
Yeah, you were fearing that there could be some spread that had caused a pathological fracture. Given that,
as crazy, as illogical as it may sound.
I can understand that. Given that so many people are in that zone of worrying about what might happen in the future, what do you think could help for that large number of people who are living with cancer, breast cancer and other cancers?
Well, I can only say what helped me, which was to talk to somebody else. Somebody that wasn't connected to me at that time. Somebody I didn't know.
Yeah.
Because I couldn't talk to my friends about it. This is not a criticism of them.
No.
I don't think they would have wanted to hear it. Because once the physical side's over, it's like friends and family, it's like that's in the background. That's the past. We don't want to dwell on that, thank you very much.
They kind of expect you to be well then.
Yes.
And portray that image of being well as well.
Yes.
So you had a chance to speak about it to a specialist in that area. But I am thinking ahead, because that kind of specialist input, that is great where it's available, but it's not always available, or even not always purchased by health providers. In other words, it's patchy, the coverage. Do you think that speaking to somebody who's been through it might help in that regard?
Yes, I think it probably would.
And
because it's well, it helps as you're actually going through cancer, because I can remember all the little times when I was scared about things. You wake up in the middle of the night and something hurts, or to talk to somebody who's been through it would help with that.
Yeah.
Realise it's actually not that much of a problem and it's nothing to be scared of.
Do you think that should be organised through the hospital, a kind of peer support system where you were automatically given the name of somebody who'd been through it but was already coping and had a story to tell and was willing to have a dialogue about it?
Yes, that could help. It would depend upon, because you've also got to get on with that person.
Yes, that's a potential issue. You've got to have a rapport with them.
You've got to have and you could be put in touch with somebody, and yes, you might have that rapport with them.
Or you might not.
Or you might not.
So there is an issue.
On the other hand, that could have happened when I went to see somebody at psycho-oncology.
Definitely.
Then you'd have to find something else.
So in a way, that's a fact of life, isn't it? And what you're talking about there is the personal touch is very important when you're recovering from a sensitive operation, because you want to feel like that person's on your side, and you're in it together in a way.
You want to feel, I wanted to feel like somebody wanted to listen, that I wasn't burdening them
I can
with
understand
my problems.
That. Yeah. Now, a different model of organising it is a group setting where you go and attend with a group of patients, not one-to-one. And then the issue of whether you get on with a certain individual is not so important, because it's a shared experience. It's harder to organise because it requires some coordination. But do you feel like a group format might be a way to go in terms of providing emotional support?
It definitely is. I mean, I go to group sessions and I think you get to know people, and you support one another. And you know you're there, you know, because people have gone along that they're going for kind of the same reasons that you are.
Yeah. There's a shared bond there.
Yes.
And having attended the group yourself in Leicester, did you feel that it's something that could be disseminated, you know, more widely to other centres?
Definitely, yes. I think it's very helpful. I wasn't sure at first that I wanted to go, but having gone to a couple of sessions, maybe I don't come out of myself that quickly. But yeah, it's very helpful. And I've made new friends.
Yeah. Well, that's an important element, because there's nothing to stop you making contact with individuals in the group and then seeing them outside of the group if you want to do that.
Yes. No. I meant no, yes, if you know what I mean. There's nothing to stop you, and yes, you can.
Absolutely. Thinking more widely about the emotional side and how it's attended to locally and also nationally, is there anything that you'd personally recommend while we're talking about it that healthcare providers think about when we're considering how to provide support for people with a feared diagnosis?
I don't know an answer to that question. I can only speak from my own experience. When I was diagnosed and going through it, the psycho-oncology service was suggested to me before. So I think the healthcare professionals I dealt with made me aware of what was available throughout.
So in other words, you saw that things were available locally.
Yes.
And that was good enough in your case.
Yeah.
Is there anything that wasn't attended to that you would have felt could have been done differently or in a more timely way?
Not that I can think of.
That's fine. So that's a good sign that for you, your care, at least in the domain we're talking about now, the emotional side was well attended to.
Yes, I think it was.
Yeah.
In fact, at first, it was suggested to me a few times. I was quite resentful. I thought, what do they think's the matter with me? I don't know.
You didn't think you?
I think they just thought I needed support because I'm on my own.
Yeah,
probably.
I understand. But initially, you were thinking, well, I don't necessarily need to go.
Yes.
I don't need to be referred. And I think a lot of people are in that boat, particularly when services like ours are badged as mental health or psychiatry.
I think that may be a problem, yeah.
Yeah. We're working on that to make these kind of interventions more acceptable to the population at large.
But, I mean, it's not only there for that, is it? It's for anxiety, the general anxiety and fear. I know, and it helps get you through those things.
Yeah. Are there any other sources of support, not our service, but outside of our service, that you felt were useful in your case? Did you come across any other resources online, support groups, chat rooms, informational sources like Macmillan, or other contacts that happen to have a cancer diagnosis that you didn't know about until you told them your story?
No.
Nothing else for you?
I did contemplate going online to things, but I think when I was at that point and going to the psycho-oncology service as a patient, I didn't want to talk to other patients because I didn't really want to talk about cancer. You don't really want to hear about somebody else's, this is what happened to me and then this happened, because it makes, if you're frightened, it makes you more frightened.
Yeah.
You want to
minimise it.
Minimise it.